Hello, it's Janelle. I am a student at the University of Edinburgh getting my PhD. I am going to be telling you a little bit during this blog on how to access the United Nations archives and library and some of the things you might find there. So in December, I was at the United Nations in New York City. You can see here the archives. They're not super exciting in that they're not right in the main building. You literally kind of go down the street into a kind of basement looking place that almost looks like somebody's house, but actually there are a few archivists there and they will really help you find a lot of different files that might be of interest to you. And so in my case, I simply went on to the archives website and I did a keyword search for onchocerciasis. So one really interesting document I found is a memo by somebody at the UNDP. And he says, I quote, "It's pointless to consider the project as a public health scheme," which is a really interesting way to look at infectious diseases. And instead, you need to justify it to these donors in terms of production and employment. Bank and the World Health Organization, they held a couple of meetings and they were trying to find one single parasitic disease that they could use to develop a model, an economic justification for investing in disease. The economists at the time really disagreed on how you could do very basic measurements in specific areas for the economic impact of a parasitic disease. So for instance, one research team said, well, it's simple. You just estimate the number of people that are blind in a given area, and then you think about the average income per capita, and then you calculate that together to find out how much production you're losing by somebody being blind. So this is purely focused on the epidemiological condition of somebody, the fact that they are blind at a certain point and they can't work as much. The second one really disagreed, and it said, well, why do we care how many people are blind at this given point? What we want to know is, as we move forward with the disease control program, how many people are likely, how many people would have been infected with onchocerciasis if we didn't have a program that was controlling for transmission. And then we'll multiply that by basically a coefficient saying how unproductive people are once they're on the path to blindness. So you can see almost all of the justification for the program. They start off by saying economic value. We are going to free lands from disease. People will be able to move back into these lands. It's a development project. That's why donors should invest. But then if you start to see actually the different personnel that they're suggesting to hire, you only have two short-term socioeconomic kind of consultants. So they're not part of the general staff. And you can see, I mean, the vast majority are people that are going to be trained to kind of look at epidemiology in certain zones and do vector control. And it makes sense in a lot of ways, but it just shows that from the start, they're going to run into a lot of difficulties in developing these models without really fully investing in them. So I think that my visit to the UN archives really brought home the fact that economic measurements of disease are really tricky, and we've been trying to get this right for 45 years. We've been trying to develop the perfect model for 45 years, and it's still not necessarily that successful. So thank you so much for listening in, and I'll be back in touch in a few weeks from Geneva.